Welcome everyone. Thank you for joining us for today's webinar. My name is Marianne. Today, we are presenting The Power to Drive Change, Working Together for Excellence, presented by Catherine Ryan. Catherine Ryan is a nursing professional with extensive corporate health experience in both private and public health sectors. In the areas of strategic and operational planning, performance and accountability, policy development, process improvement, change management, clinical governance, safety and quality, risk management, and standards-based work. Catherine is currently a member of the Partnering with Consumers Advisory Committee for the Australian Commission on Safety and Quality in Healthcare. Catherine has led the consumer and community engagement portfolio for the past 4 years at the Royal Brisbane and Women's Hospital. Just a little housekeeping before we get started. If you have any questions during the webinar, you can enter your questions into the questions pane and click send. The presenter will be answering questions after the presentation. Today's webinar will also be available on demand after the live session on the IHF website. Now, without further ado, we'll turn the time over to Catherine. Catherine, you may now start your presentation.
Good afternoon, Marianne. Thank you for that lovely introduction. I'm really pleased to be able to talk to you today about the journey that the Royal Brisbane and Women's Hospital in Brisbane, Australia has been through in the last 4 years. So without further ado, I'll start my presentation and I'll take my face off the screen and let you look at my PowerPoint slide. So in 2011, the Australian Commission on Safety and Quality in Healthcare introduced 10 mandatory national standards for safety and quality to Australia. This provided a consistent approach for all health facilities in Australia, and a lot of this work we had health facilities had been undertaking their national priorities around safety and quality, but there was one new overarching standard which was partnering with consumers. So that's there's 10 national safety and quality health service standards. The first one is around governance and the second one partnering with consumers. And those two standards are overarching standards which are embedded in the other 8 clinical standards. This was quite a challenge for health facilities in Australia. We have a very medical model, and while all the other standards are challenging and a priority for us, this partnering with consumers needed a whole new philosophy and a whole new approach and framework. In addition to those 10 national standards, the accreditation body also added 5 additional standards which health facilities could also comply with, and the Royal Brisbane unanimously decided that we would also undertake those other 5 standards. And I won't go through the standards with you, but I've got them on the slide for you to review. So for the Royal Brisbane, the defining moment for Standard 2 was when we decided to move past compliance. Originally, when the standards came out, we needed to do an audit and check our compliance. We did not meet the standard in any way, shape or form, and so it was a massive challenge for our organisation. Thinking about this presentation, I needed to reflect on the journey and what actually, what were the core elements that enabled us to develop a sustainable and continuously improving framework. There's a couple of key things. So the leadership vision and commitment to change is paramount. Without our executive director without the leadership commitment, we would not have been on the journey that we've been on. Secondly, appropriate resources. While We have done a lot of the work within our existing resources. It is important to have resources in terms of people who are committed to the philosophy of partnering with consumers. Employing the right people to lead is a key concept for success. We also had some budgetary requirements for educational development and resources. Key to the health reform that was coming through in Australia in 2011 was, along with consumer engagement, was clinician engagement, and that is crucial that clinicians working in the service delivery areas that could be empowered to make changes. Along with that clinician engagement, the patient, family, carer, consumer engagement was paramount. That was the key, the untapped resource in terms of helping us deal with the challenges that we're facing currently in healthcare. We needed reportable goals. We needed the staff to understand what we were trying to achieve and to see how we were going in terms of meeting those requirements. We needed measurement to drive improvements, and we implemented a patient experience survey for quantitative and qualitative measurement, and we needed consistent and effective communication. And those were our key success factors. So with that in mind, we started our foundation with relationship building. We recruited consumers to work with staff to develop the framework and the approach that we were going to take. So we needed, the basis of the terms were trust, respect, commitment and transparency. 4 years ago, this was a very alien concept to clinicians to have patients, families and carers to come in and talk to them about their experience and how we could improve our services. One of the key things that that is significant in this body of work is to ensure that staff and consumers are working to a mutual common goal, because consumers and staff working in different areas don't have the same power as when we're working together on a common goal. Along with that relationship building, we also started to build processes. We developed a framework. So our framework was to build a robust and meaningful partnerships with our consumers and community. We needed certain supports and structures in place, and I will talk about those a little bit further on in the PowerPoint. The next thing we did was implement. We implemented consumer engagement in 3 areas: in the service planning and design, in service delivery, and in service monitoring and evaluation. And on my diagram on the PowerPoint, you can see that we had the 3 domains which are key to our partnering with consumers standard. And we can engage with consumers at 4 levels: at the individual level, so in direct patient care; at the service level, so in critical care services, as an example; at the network level; and at the system level. So at all levels, we need to have consumer engagement and representation. And in that engagement and representation, there's actually 5 elements. And this is the IAP2 framework around community engagement. So it can be for information, consultation, involvement, collaboration or empowerment. And we really have been, we've really moved forward to the collaboration stage at the Royal Brisbane Women's Hospital. So we needed to have a measurement. The health reform said that we needed to measure our patient experience, but we weren't given a means to do that. We actually adopted the PIC Institute Europe and the Care Quality Commission Patient Experience Survey, and we measure those, the survey on the 8 dimensions of patient-centred care. So the 8 dimensions of patient-centred care, 3 concern the relationship between individual patients and professionals, so respect, information and education, and emotional support. And 5 relate to the way that services and systems work, so involvement of family and friends, transition and continuity, coordination and integration of care, access to care, and physical comfort. So all our patient experience, feedback, our complaints and compliments, our feedback and suggestions all come through under those banners of patient-centred care, so that we can give clear, consistent messages to staff about the areas that we're doing well at and the areas where we can improve. We also validated. So validation is really a key to effective consumer engagement. So we validated through documentary evidence. We have ongoing consumer surveying. We validated by the unit leaders, checking with family and patients in the service areas, by regularly assessing and discussing the outcomes on the unit, by external leaders such as Director of Nursing, the executive, doing walkarounds and checking with patients, families and carers, and also with the staff, and with the family after discharge through a discharge phone call in some areas of the hospital. So through this process we have a continuous improvement philosophy, and it's a key principle of consumer engagement. So in Australia we have a safety and quality framework, and it's three-dimensional. So it's consumer-centred, driven by information, and organised for safety. So anything that we do in terms of redesign, planning, in our governance, make sure that it's consumer-centred, include consumers, include consumer feedback. Driven by information, so our consumer feedback is a key bit of information in terms of driving this portfolio, and organised for safety. So planning and evaluation is really crucial, and that's the simple framework that we use in all of our consumer engagement initiatives to build our sustainable approach. So we developed our consumer and community engagement framework, and we started with really core governance. So we had the Royal Brisbane Women's Hospital's Consumer and Community Engagement Committee, which was the key governance committee, staff and consumers working together on that common goal. And in the early stages it was around developing the framework and managing compliance with the standard. Once we got that compliance, we very quickly moved to the philosophy and to become an area of excellence in terms of consumer engagement. We have an Australian Charter of Healthcare Rights. It sets out the rights of consumers, and that is our core governing tool, and it's something that all staff have mandatory training in and talk to the patients, families and carers in the facility. Our partnering with consumers philosophy is interlinked with the other national standards and the other committees. We have consumer representation on all of our governance committees around safety and quality, and they're Tier 1 consumers who work very vigorously and actively with our staff. And we have policies and procedures to guide staff. Our patients' experience is our core measurement, and we ensure that we provide that performance reporting to our consumers. You can see in the middle the 8 dimensions of patient-centred care, which is what our framework is built on, and it's all about safe quality outcomes, so consumer and staff working together. So our systems that sit under that, we've structured them under 4 key areas. So our capacity to hear, our capacity to engage, capacity to understand, and capacity to deliver. So in the systems we've got, under capacity to hear, we've got our patient experience survey. We've got a local model of consumer participation, and that is encouraging the conversation at the service delivery area to have a proactive approach to any issues or concerns, and mirrored on that is the feedback and suggestions methodology that we have to get that conversation happening between the staff and consumers, so that we proactively manage any issues so that our complaints are minimised. We do have our traditional complaints and compliments system, which is used as well, and we also have weekly bedside audits where we get consumer feedback around key issues. So capacity to engage, we've got quite a few systems. So we've got a consumer registry. We've actively recruited consumers to work as part of the Consumer Representative Program. They're across 17 or so governance committees in the hospital around safety and quality, so in service lines and in safety and quality governance committees. We have developed our own consumer training so that we can support those consumers to be involved in discussions and committee meetings and to understand the safety and quality agenda of the hospital. We also have staff training, which we've been doing for 4 years, and building that capacity of staff to understand the intent of the new philosophy and to have skills and abilities to be able to engage effectively with consumers. We have a patient story library which we use to educate staff, and our consumers are very involved in training the staff. Capacity to understand. Health literacy is having a renewed focus in the second version of the Partnering with Consumers standards, which will be out next year, and that's looking at the key strategy we have is around consumer information publications, making sure consumers are involved in the development or review of any publications for patients, so that we provide the information that they need and we provide it in a way that they can understand. So capacity to deliver, we have a consumer engagement activity register, and there's an icon on everyone's desktop that they can go in and actually put in their activity in the planning stage, and as they develop their activity and evaluate and get their outcomes, it's all on a central register so that staff can go in and see evidence of best practice. We also last year started the Inaugural Patient Experience Week that was done by the Beryl Institute, and that was a great time for staff. I've got on a slide there just some pictures of staff. We asked staff to commit to the philosophy, and those staff came and had their pictures taken with the signs, "We are the patient experience," or "I am the patient experience," and all our executive directors participated in that, and it was a very great community engagement for both consumers and staff. And we do have some of our consumer representatives in those photos. The 8 dimensions of care, as I spoke about earlier, I just wanted to talk a little bit about the metrics that we use around patient experience and how important those metrics are in driving the cultural change that we required. So with the 8 dimensions of care, through the patient experience survey, we can easily see how we're mapping in terms of those criteria. And I've put a slide up there for you to show the inpatient experience results for 2014 against those domains. So we've got areas of high performance, areas of excellence, satisfactory performance, priority areas for improvement, and you can clearly see the areas that we need to improve on. And the patient experience survey we are currently doing for 2016. So our target is for a overall score of 9 out of 10, so that we can be an area of excellence. We have many areas of excellence within the facility, so the dimensions of care we do from an organisational perspective, so we can see the RBWH overall score is 7.9 out of 10, and the outpatient score is 8.5 out of 10. And then each service line has their own score, and then each ward or outpatient department has their own score. And in the outpatient departments, there's many areas that have got a score of 9 or more out of 10. We can also see in each of the dimensions how we're tracking. Our information and education in 2014, you can see that was 8.9. I think it's currently sitting around the 9 for the organisation. So it's a quick snapshot for executive to see how we're trending in terms of and how we're improving in all those areas. The survey provides a lot of really concrete information. So each area can actually drill down to the individual questions and see what areas they need to improve. So it actually gives staff concrete information to improve the patient experience. An example would be in one area that the transition and continuity, so their discharge processes are not, the patients aren't being told about their changes in medication before they're going home. So they know then that in their action plans that they would put in strategies in place to make sure that every patient prior to discharge has a really good understanding of what their changes in medication have been. We also look at the patient journey, and that is comes much more from a clinician point of view, where you can see the doctors, the nurses, other health professionals, and how they score. And they are, I'm pleased to say, they are high-performing professionals in terms of patient experience. So the model of local consumer participation was put in place to help us to improve our patient experience. And we have a poster displayed for staff and a poster for patients. We ask them not to, staff not to display the posters until they are committed, because it is a commitment to the patients, and we actually have that on the patient poster. This is our commitment to you that we will resolve the issue. The feedback and suggestions brochure actually gives consumers the opportunity to nominate, to work with us on some of the activities that we're undertaking, and also to provide us with any suggestions. We use the patient stories, and the patient stories are used to inspire staff, to educate, and to improve service and quality. We have a requirement, we have a schedule, and each service line actually develops up real patient stories that we can use to further improve. So, high performance organisation, just to clarify, we need focus, accountability, engagement and commitment. So as I said from the beginning, the leadership, vision and commitment to change. We need a clear focus. The leadership needs to hold staff accountable to the cultural change, appropriate resources, clinician engagement, consumer and patient engagement. So engagement is key. It's not just about clinician engagement, it's all staff need to be involved, and we do our education from the patient support officers, the admin officers. Every single person is part of the patient experience. We have our reportable goals through our organisational plans. We have a really clear measurement to drive improvements, and consistent and effective communication through our 8 dimensions of care. What are we doing well? And I can easily say what the Royal Brisbane does exceptionally well and what areas we need to improve on. So on that note, I'd like to I think my time's just about up. I'd like to put the session open to any questions.
Thank you, Catherine. We'll go ahead and take some time for questions now. Just a reminder, please be sure to type your question and click send. There's one question from Abish. What are the major complaints you face on everyday practice?
The major complaints is around staff behaviour, and in the last couple of years in Queensland we've had massive cuts to our staff because of, which is definitely something that's happening right across the board, and staff awareness that they're very busy and they're not, the patients are telling us that staff are too busy to talk to them, and I'm sure that's not the staff perception of what they're doing, but that is what the patients are telling us, that they don't want to ask questions because the staff are too busy. So in our model of local consumer participation, on our poster we actually put we asked for consumer feedback about that, and what they said is, well, we would never ask or want to talk to the staff about issues because they're always so busy. So we actually put on our poster, even if we seem busy, please, we want to hear what you're saying. Does that answer the question?
He said it answered his question. We have another question from Maria del Rosario Perez. She said, many thanks for this excellent lecture. She wants to ask whether radiation safety will be considered in your framework, safe and appropriate use of radiation in both diagnosis and treatment.
Yeah, so that's a good question. With the framework that we've developed, we use consumer participation in every area of the hospital. So in terms of radiation safety, any initiatives or change in practice, it's a requirement that consumers are involved in developing policy, developing patient information, looking at the, any information and analysis, and ensuring that the clinicians are appropriately talking to the patients in a manner that they can understand, that they're actually included in discussions about their treatment and diagnosis, and that they're a partner in their care. So we have consumer involvement as a partner from the individual care right through to the governance in that particular service.
That answered her question. We have another question from Liz. She's asking, how long did it take you to develop and implement the framework and change the culture within the hospital?
Yeah, that's a really good question. Thank you for that one. We've been on that journey for 4 years. In the first year, it was very difficult. We had an executive director who really supported and had the vision of where we could go and how important that would be to the organisation. But it took a good year before we started to get some people on board. We had a core group of people working together, staff and consumers, but it wasn't until we did the patient experience survey and that people got to see the measurement. I think there was a lot of assumptions. There was a lot of assumptions that the patients were going to say all bad things about the organisation and the staff, and actually a lot of very good information came back about the things that we were doing really well and then areas where we could improve. So I think that was really valuable in terms of people having a little bit better understanding that it wasn't about people talking about their personal experiences and being on a bandwagon, but it was about working together to improve the services, the information, the patient understanding, their involvement, and all the research shows that if patients have really good understanding of what's happened to them and their conditions, or when they go home, their self-management will be a lot better. There'll be decreased readmission rates. There'll be less medication errors. There's a whole ream of research to show the positive outcomes.
We have another question from Eric. For refurbishment or constructions, do you have a way to get patient perspective?
Yes, that's a really good question from Eric, and I have met Eric a couple of times. This is a really challenging area for the organisation. The corporate governance is an area that's taken us a while for those staff to embrace. However, the requirement is that if we're refurbishing a ward, that they would get patient feedback about the current ward environment, what were the issues where the patients felt it wasn't safe, and then use that feedback to actually make improvements. And we have had a really good activity where consumers were involved in a night lighting project where the door frames for the bathrooms and different areas were just highlighted with very slight lighting so that patients didn't feel disorientated when they got up at night, and so to try to minimise the falls at night. And that was a direct result from consumer feedback.
Okay, we have another question from Godofredo. His question is, one of the major problems in hospital right now is medical error. How are you going to train your nurses when they encounter medical error so that patient safety is implemented?
We have a really strong staff training program in patient-centred care, and that's really, we've got a lot of activities around medication error and how we improve that. But from the engagement process, we educate our staff about ensuring that patients know the medication, understand what they're taking it for, understand the side effects, any things to look out for, because patients are the centre of their care, and if they understand their medications, if a clinician brings a medication and they know their medication, they know that's not right, they're actually a safety measure in terms of telling the staff that it's not the medication they normally take. So from that perspective, that's how we train our staff in terms of working with patients, so patients to be empowered and to understand their treatment. A lot of the activities we put in place are for the patient's safety, and the biggest feedback we've gotten from consumers that review is that we put out lots of posters and different things about different issues, but we're not clear that it's about their safety. So that's the most consistent feedback we've got from any patient information publication that we've done, is to let patients know, patients' families and carers know it's about their safety, and that's why we've got certain systems in place and why we do certain things, such as checking their ID, etc.
It looks like we've answered all our questions. So, Catherine, is there anything else you wanted to cover before I wrap up?
Yeah, I'd just like to reinforce the importance of having consumers involved, and I'd really like to put the challenge out. I don't know what's happening in the rest of the world, but I'd really put the challenge out there to you to really embrace this philosophy. We found it extremely valuable, and it's really brought lots of different perspectives, which has actually really improved outcomes for patients and also for the organisation. I can give a really good example of our patient liaison service. We're getting quite a few complaints coming through. There was a couple of issues, so we undertook a redesign process, and we actually had two consumers involved in the redesign team, and then we did a consumer forum, and we asked the patients about the patient liaison service. And it was interesting that the hospital viewed the patient liaison service as a complaints management, a complaints and compliments management process, and the consumers viewed it as an advocacy service to help them navigate the system. So there was a great disconnect between what we believed the service was and what the consumers believed the service was, and so that service was getting inundated with really inquiries, which were being taken as complaints rather than inquiries. So that's led us to a whole body of work that we need to do around our patient information on our internet site, and just that health literacy solutions for navigating the system. And that's been a really valuable, and that will save the organisation a large amount of time, money, and also really improve patient satisfaction and efficiency of services to resolve that particular issue. So yeah, just to reinforce that, I can't say highly enough how important having that partnership with your consumers is to an organisation. And I just want to thank you for having me this afternoon. I've really enjoyed talking to you. I wish I could actually see all your beautiful faces, but yeah, thank you very much.
Thank you, Catherine, for sharing your valuable knowledge. Thank you, everyone. Today's webinar will be available on demand at the IHF website. You will also receive an email with the link to view the recording of this session. Thanks again for joining us today, and we'll see you next time.